Hi, I'm Jason Lind, and I'm going to just explain a little bit about our phase-in process and our plan for bringing kids back into the building. I'm just going to go through a few slides and see if I can explain some of the ideas that we're talking about for bringing kids back into the school. Again, this is flexible as the information that comes from the state and the health department is changing on a regular basis, but this is what we are thinking at this point. So let's get started. Before we come back, there's two categories that we need to consider. The first is the spread of the virus in our community. We're going to look at the numbers and see what they are at as far as the safety and when is it okay to return and when should we be taking more restrictive measures. I'm also going to talk about the safety protocols that are required by the Illinois Department of Health and the Illinois School Board. So there's two different agencies that we're working with protocols on how to keep our kids and teachers and staff safe. So those are the two areas that we're going to talk briefly about before we can talk about returning to school. First, let's talk about those numbers. Where are those numbers at? This was given to us by the by the Lake County Health Department last week. And so we've been asking for this for a while. And when I say we, I mean the superintendents in the area in Lake County have been asking for some information and some numbers that we can kind of hang our hat on and say, this is when it is safe to return and this is when it isn't. So how can we know as superintendents, we are not epidemiologists, when is it okay to bring students into the building? Well, this is what the Lake County Health Department, in working with the Illinois Department of Public Health and ISB and other departments around the state, have come up with. As you can see, when we are in they're looking at three different aspects. They're looking at the incidence rate, COVID-19 like illness admissions, and the diagnostic testing turnaround time. So I'm going to briefly explain each of these and then show you right where we're at. And as you can see, giving it away right away, we are right smack dab in the middle of the hybrid model. But let's talk a little bit about these measurements that we're going to be using, and then we can talk about these three phases. So the measurements, incidence rate, that's the number of incidents per 100,000 population. So that's a calculation that the Lake County Health Department uses to determine how much COVID on a daily basis is being added or increased in our county. They're saying that if it's greater than 14 per 100,000 in the population, that's a time when we should stay home and not have any kids come into the school building. So that would be a virtual or remote learning environment for all of our children. If it's greater than 14 per 100,000 and they're using a 7-day rolling average. If the numbers are within 7 to 14, they're saying that it's safe to bring small groups of children onto campus. We won't want everybody coming back, but we can bring small groups of kids, and under certain circumstances and priorities that we'll talk about later, we can bring them back onto campus. Currently, we are sitting at 11.1 is our latest measurement as of last Friday. And that is well within the 7 to 14 range. I will point out it's been as high as 13.4 in August. So we were bumping up against the, getting to that 14 per 100,000. So in recent weeks, it has been as high as 13.4 in early June. Or mid-June, June 19th was the low point, and it was down to 4.6. So that would have even fell into this in-person category that my head is hiding at the moment. So we've been lower in June, right after we had the lockdown and more restrictions placed on us. And since we've opened up some of the businesses and restaurants in Lake County, we're seeing that number creep up. But it has been relatively steady as of late and has not gotten above that 14 mark. So that's one of the numbers that the county is looking at and telling us that it is currently safe to bring groups of children back into school. Just as a point of comparison, on May 17th, at the height of the spread and outbreak in Lake County, the number was 26.7, just as a point of comparison. So we can see how that number has fluctuated. The other measurement that the county is looking at is COVID-like admissions. So if there's admissions to hospitals and they look at the rolling average of 7 out of the last 10 days, is it going up? Is it going down? Is it stable? If it's stable, that's great. Currently, we are at a stable level. It has gone up only 1 day out of the last 10. So we've been very stable in that area. So that's good. And that allows us to go into this hybrid model. And it also is the same metric for the in-person model. So we're well within our range there. The third item that they've asked us to consider, or that they would consider in determining that it's safe for us to return to school, is the diagnostic testing turnaround time. So if we're waiting more than 10 days to get results for tests, at that point they're saying that's going to be a problem and that's not going to help us with contact tracing, and the spread of the virus could become out of our control again. So that's the third item that they're looking at to say, well, in this case, it's safe to return. So we are smack dab in the middle of this hybrid model. Let's talk a little bit about what that means here. A virtual would be, of course, everyone 100% in the remote setting. That would be learning from home. A hybrid is some students learning from home and some students learning in school. And an in-person would be everybody returning to school and being able to come back. So currently we are cleared as far as the metrics go. As far as our numbers go, we are safe to return students to school. The second area that we have to look at are the protocols. And this is what's really been keeping us from opening on time. One of the biggest challenges has been the constantly changing protocols, and it may seem minor to some people, but to us it's very important because we want to keep our kids and our staff safe. So we want to make sure that we are following the protocols that we need to follow in order to open safely. I'm only giving you a few examples of some of the protocols that have changed recently. The initial frequently asked questions that I'm taking this from was created on June 25th. So June 25th, they created a document of frequently asked questions, and by they, I mean the state of Illinois, the Illinois State School Board created this document, and they've been updating it regularly ever since June 25th. Some of these are changing now daily. For a while, it was every week we were getting updates, and now it seems like it's every day. As you can see, it updated on the 8/13, 8/19, 8/18, 8/20, 18, 18, and 8/20. So this has been the most frustrating part of trying to return students on campus. Some of these are pretty major. So last week, updated, if a student is sent home sick with suspected COVID symptoms, that means they have any of these symptoms: cough, fever, diarrhea, shortness of breath, etc. There's a long list of symptoms. Must all their siblings or household members be sent home as well and quarantined for 14 calendar days? Well, the answer to that one is yes. And that was updated last week. So if we send a student home with any symptoms, perhaps a stomach ache or a cough or any of the symptoms that are on the list, all of their siblings would have to be quarantined for 14 days unless they can prove that it was not COVID related. So in other words, anybody that we send home from school that has any of the symptoms or that reports any of the symptoms on our screener, they would have to, their whole family would have to be quarantined then for 14 days until they go to the doctor and get either a negative COVID test, or it could be that the doctor would do for example, a strep throat test and determine that it was strep throat. So it would not be COVID related in that case. So I'm not going to go spend too much more time on this, other than to say these protocols are changing. They're complicated. We're working through this, and that has been the biggest reason why we haven't been able to open as of yet. So the Lake County Health Department also recognizes that this should be a phase-in process, starting with virtual and moving to a hybrid, and then for a full in-person model. And that is just a different look at this virtual hybrid to in-person progression. So we are currently in a full remote virtual environment. And again, according to the numbers, we are able to move into a hybrid learning environment based on prioritized risk and having some people on campus and following all the protocols. So what we are working on now is getting the correct protocols in place for us to be able to open. I will mention too that with protocols, one of the changes that happened last week was the requirement that school nurses who are assessing a student or staff member reporting a symptom must have the correct PPE, and they added an N95 mask, a gown, and gloves to that, and which doesn't sound bad, except that N95 masks have not been available to schools this summer because they've been prioritized with healthcare facilities. So we have been unable to procure N95 masks until recently, and we have ordered them, and they are back ordered, and we're trying to get them as quickly as we can, and we're working on that. So that's been quite a challenge for us. We do have some masks to get us started. So we did procure some masks, but we will definitely need more as the school year opens and as we bring more students on campus. Also, that involves getting fit tested and for all of our nurses, and that's a process and takes some time as well. Along with our custodians, and that custodians who clean areas of suspected COVID cases also must have an official N95 mask and be fitted for that before they are able to clean that space. So what does Millburn's phased-in approach look like? Right now we're in phase 1 with everyone doing remote learning, early childhood through 8th grade. As we start to prioritize on who we bring back, we are following the state guidelines. The state guidelines tell us that the younger children and children with special needs and at-risk students and students with English as a second language who are more impacted by remote learning need to come back first. So that's what we are prioritizing. We are going to start with early childhood and kindergarten along with Group A. Group A is our structured learning program, cross-categorical programs at MES and MS. Those are self-contained special education classes. So that first phase will be early childhood, kindergarten, and Group A students. We would like to start that on September 9th. September 9th is the first day that our students would be in school or be available to be in school after Labor Day weekend. So Labor Day weekend, or Labor Day, is the 7th. On the 8th, we have a staff training day. And then on the 9th, we would plan to bring in this group of students. We're starting small to make sure that we are able to do this and to be able to handle the protocols and make sure that it's safe for both our children and staff in the building. Provided that that goes well and that our numbers stay low and we are okay to progress, the following week we would add first grade to that list. So we would have kindergarten, we'd keep the same group in, and then the next week we'd add first grade. If that goes well, the following week, then our anticipation of second, third grade added to that group. Then the next phase would be fourth and fifth, and possibly sixth at the middle school. So sixth grade, we would start a rotation then at the middle school of sixth grade that first week. The second week, sixth grade would go home, and then we'd go to seventh grade. Seventh grade would go home the following week, and then we would bring in eighth grade. Middle school is a little bit different and more complex. So that will take a little bit more, there's just more moving parts to that. So bringing in one grade level at a time to start with until we get more efficient or the numbers come down better and we're in a more safer environment. We'll be bringing in one grade level at a time. Phase 6 then would be if we could bring in K-8 all together at once, all of those that chose to be in person. So hopefully we can get there this year. That's our definite hope, and I think that is a possibility at some point in the school year, depending on how the community spread numbers are looking and how healthy we can remain. If we follow the protocols and we don't send kids to school who are sick, and if our staff, when they're sick, they stay home, and we don't spread whatever illness is out there, whether that be COVID or the flu or strep throat or anything else, we want to make sure that we follow all the protocols, and that will help us get more kids into school for a longer period of time. Finally, when we do come back, as I was talking about and alluding to a little bit, we have to be very, very strict. These are non-negotiables from the state of Illinois and from the Lake County Department of Public Health, carried down through the Illinois Department of Public Health, the decision tree for symptomatic individuals. So if a student or a teacher has any of the following symptoms, we must send them home and they must quarantine for 10 days. Any family member must also quarantine for 14 days. Now, we don't control family members who may be working in other environments, but in my case, because I work in the schools, if my daughter or sons are sent home for any of these symptoms, I would be quarantined for 14 days. The person or the student or the adult who has the symptom would be 10 days because there's an assumption that they've already had the illness building for 4 days prior to that. So any of the following symptoms: fever, headache, shortness of breath, cough, sore throat, vomiting, diarrhea, abdominal pain. In addition, the following symptoms: congestion or runny nose, new loss of sense or taste or smell, nausea, fatigue, muscle or body aches. So for any of those that are sent home, any of those that are exhibited at school or at home, we must stay home or send that person home. So how do we get back into school after we send somebody home? Well, we can wait for 10 days, and if symptoms go away, we'll be fine, and that student can come back to school. And any family members after 14 days and there's no symptoms, they can come back to school as well, or with a doctor's note. So if we send someone home for a fever, they must go see a doctor and get a doctor's note to be cleared to come back into the building. If a doctor does, again, a strep test and find out they have strep throat and that's causing that fever, then we know that it's not COVID related. Or if it's a negative COVID test, if we go get a COVID test and show that it's a negative test, then we can come back to school. So hopefully that testing turnaround time remains low and continues to even get lower so that we can rapidly determine if someone has COVID or not and can be cleared to come back to school. So we will be sending out more information about this as we get closer to bringing kids back into the building. So with that, of course, I always welcome questions, and this is for a board presentation as well. So this won't be live, but feel free to email me anytime, any questions that you may have. The resources are the Lake County Health Department metrics and the Illinois Department of Public Health and ISB. So if you want to go on those websites at any time, Lake County Department of Public Health, Illinois Department of Public Health, or the Illinois State Board of Education, all of this information can be found in those websites. Thank you, and we will continue to be in touch.